After cancer treatment, what next? Do we really have to resort to a watch and wait strategy that is basically confined to having a couple of scans done maybe every 6 months or every year? I'm Kirstin Nussgruber from Kirstin'sCancerCare.com, and I help people with cancer get out of overwhelm by teaching them how to reclaim their lives. And one way in which we cancer survivors can do that is to understand that we do not need to sit back and have a watch and wait strategy to hopefully prevent a cancer recurrence. We can be very proactive and practice what I like to refer to as proactive prevention. Now, I'm going to focus on a couple of key strategies here that you can start employing right away. Now, I already mentioned you're going to have a couple of scans every now and then, and those are very, very important diagnostic tools. We have to keep on checking what's going on inside the body. But we need to do that from various angles involving various things, issues that can affect us. They can be physical, mental, emotional, and spiritual. Now, they all play a very important role in any healing regimen, but particularly for us cancer survivors. So, the physical structure. We need to know, is there future cancer growth happening? So for that, we obviously need to stay in touch with our oncology team and undergo the regular scans, CT scan, PET scan, MRIs, and whatever else there is. They also do very basic blood work. We can expand on that. So if you're not privy to an integrative oncologist that does that approach right from the get-go, you can expand your practitioner team. And that's really my number one key strategy, is that we make sure we have a reliable practitioner team that takes care of looking at all of us, what's going on inside of us that gives us clues about a possible scenario that could be conducive to cancer growth. So the scans that we do are looking for tumor growth that has already happened. That's how they pick that up. We, though, want to actually look at what else can we microscopically see and view and understand are hallmarks of cancer growth, earlier signs that give us an indication that something is not quite right on that front. So part of a really good, reliable practitioner team is to have an integrative practitioner, and that can be an integrative oncologist, and you can find those through the Society for Integrative Oncology. Those are MDs, oncology MDs that have received further training from an integrative approach, where they use conventional treatments, but they include alternative or complementary methods together to enhance overall cancer care. Or naturopathic oncologists, they usually work side by side with your medical oncologist as well. Or other practitioners, functional nutritionists, who will look at nutritional deficiencies, for example. So there are a lot of areas that we can focus on that we can employ. Like I said before, we need to understand there are two paths here. So the one path is covered by your health insurance. That'll be your diagnostic scans and tools and certain pretty basic blood tests, but we can employ some of those certain markers that give us clues as to, is there inflammation going on? Is there an environment that could, again, induce the inability of cancer cells to die? Or is the environment that cancer cells can take advantage of in terms of immune system, suppressing the immune system, sending out certain signaling molecules that feed cancer growth, that attract blood vessels to them? Those are markers that we can look at. Those are called certain biomarkers, and there are a whole group depending on which type of cancer you have. But then there are other markers of particular inflammation that we look at as well. Certain nutrient ratios and deficiencies. For example, if we are high in copper and iron, that could potentially lead to an environment that is conducive to cancer growth. Those are certain markers that we can order through our normal lab work and is covered by health insurance and helps us keep an eye on the internal environment and early changes that could, from a structural point of view, be conducive to cancer growth. Then there are the so-called more functional tests. Now, one very important functional test that is recently, I mean, last couple of years, but being developed a lot, are these circulating tumor cells. Now that gives us information on individual cancer cells that are floating around. And that is a sign of those potential cancer cells. If they multiply, if there is a trend over time that they increase, that could lead to metastatic cancer and tumor growth elsewhere. So that's a very important piece of information for us to understand. Is activity happening on a cellular level that no scan can pick up yet, because this is not yet a tumor. These are just cancer cells. It can be very daunting for some individuals, and if you're prone to high anxiety, ask yourself the question, is this a test for you? Is this part of a test that you want to include in your overall cancer regimen? And these tests are covered by health insurance, by the way. Generally, you have to find a practitioner who's willing to run them for you. An integrative naturopathic doctor or oncologist is probably willing to do so. But health insurance does cover this type of diagnostic test. And then we want to know, is there a trend? So just to have that test done once is not going to give you a lot of information. You kind of want to know, is there a trend upwards? So if you, for example, have some circulating tumor cells, although it of course depends on the kind that you have and the number that you have, is there a trend upward? If you're on the very low end of the range, and that can very well be, because if we've had cancer, the chances that we have individual cancer cells floating around is very high. The chances that those start consolidating into a tumor, well, it doesn't necessarily have to be the case, and that's where we can intervene with strategy number 2. And that is a nutraceutical supplemental approach to influence the internal environment and address hallmarks of cancer from a nutrition point of view. This is where we look at, first of all, what micronutrient deficiencies do we have? Are we deficient in certain vitamins and minerals, amino acids, antioxidants that we should be getting from a whole foods approach, right? And if not, we can supplement, we can target supplement, because we can measure what are we deficient in. Micronutrient tests, for example, are offered by functional labs like SpectraCell Labs or Vibrant Wellness Labs. And they are generally also run by a integrative practitioner, an ND, naturopathic doctor. You can get some of them done even at some of the integrative pharmacies as well, where you will get help in terms of understanding the results and knowing how to tweak your nutrition approach. Very, very important piece of information, because these micronutrients work in synergy with each other. If you think of how wonderful our body is and how complex biochemistry is in the systems that exist, so micronutrients work with certain enzymes, with certain cofactors that lead into enzymes, that lead into, for example, proper detoxification pathways. Very, very important to understand that, for example, if we have a vitamin A deficiency, well, we need to make sure that we have, for example, a certain enzyme that can activate vitamin A, and that enzyme needs zinc, for example, is dependent on zinc. Or if we look at vitamin C, the vitamin C component is a coenzyme, a cofactor to an enzyme that plays a key role in collagen synthesis. And that collagen we need for wound healing, if we bruise easily, and of course for bone and joint health as well. So nutrients work in synergy with each other and also with certain enzymes, certain cofactors. Very, very important soup that's going on inside of us. We need to make sure that we're not deficient in any of them. And just thinking we're eating whole foods isn't necessarily going to guarantee that we are not. So that's, for example, a very important, more functional lab test that we can perform to see and make sure that everything is all right on that level. We can take that a lot deeper, and that goes into figuring out what was our internal environment before we got cancer? Were there certain weaknesses? Did I have, for example, heavy metal toxicity? We need to address that if that is so. Do we have an issue with mold and mycotoxins? If so, we need to address that. And sometimes it's as simple as understanding, is my home infested with mold? Is my workplace infested with mold? Or am I consuming foods such as peanuts, for example, that have a higher propensity to being infested with a certain type of mold? that's all pieces of information that is very useful for us to understand what is the inside, the internal milieu like, and is it creating an environment in which our immune system is just too stressed out to be able to cope. Of course, paving the way for the potential of cancer growth again. So key strategy number 2 is make sure that we collect data through lab work, through certain testing. And of course, that's what I do with my clients. I advise them what type of testing you can do, what type of testing will be covered by health insurance, what type of testing needs to be done on a 3 or 6 month basis, or what type of testing is all right to do on an annual basis. Very important and absolute foundational strategy on my behalf as well for my own post-cancer care. Then we look at the third strategy that I want to focus on today with you. And that, of course, as a nutritionist, very important to me, is a whole foods clean approach. What we eat matters, and what we eat, we become. So eating clean, and that means organic, or if we know that no pesticides, no prophylactic antibiotics, no growth hormones have been applied, that's fine too, like some of the local farms are not necessarily organic because it's very expensive to become organically certified, but you can start a relationship with the local farmers. You can speak to them like it used to be. Ask them these questions. How do you treat pests? How do you, in your livestock, if you're eating meat, how do you treat an outbreak of disease? And get information, get feedback to try and make sure that you focus on sources that are as clean as possible. And there are various levels here to apply as well. But clean whole foods, you need to be able to make your own foods. You need to go back into your kitchen and cook real foods. And most of the time, you're eating at home with ingredients that you can control. Very, very important. Because lots of the ingredients that we are exposed to can systemically lead to inflammation and create, again, an environment that just suppresses the immune system. So this is within our control, what we put into our mouths. That's something we can regulate and control. And making sure we just learn how to cook. And again, that's what I teach my clients to do. It's not complicated. We don't have to create 4, 5, 6 course meals every time. In fact, it's actually very easy to do. And a big component that I focus on is my so-called fast food approach, my style, meaning in a clean style. But there are such things as fast food options in the whole foods nutrition world. The last strategy that I want to focus on today is movement. Very, very important in our sedentary lifestyle, and maybe post-cancer care, you're going back to the job that you had previously. Maybe it's a desk job where you're sitting a lot, but you need to understand how important movement is, besides having toned muscles and heart health, for your detoxification system, your lymphatic system. Now, the waste products from our very normal metabolism, plus, of course, waste products that we have incurred from outside, need to be eliminated by our body, collected and eliminated. And our lymphatic system is a very important organ system that has lots of little vessels that are connected to lymph nodes spread all over the body, similar to a blood vessel system, but it's not connected to a pumping heart like our blood vessels are. So the only way that lymphatic fluid can travel around the body and collect waste products and activate lymph nodes is through muscle contraction. And that will not happen when we sit still. So we need to move. And it doesn't mean you need to become a superstar athlete or marathon runner, not at all. We don't want to over-exercise either, but we want to make sure that we at least have muscle contraction. You can walk, put in walks if you're at work. If you think, how am I going to fit that into my day? You can walk stairs, for example, instead of taking elevators. Park your car further away, walk, whatever opportunity you have, bring movement into your day. Commit maybe to a group. Maybe you're doing group classes. That's always a very great motivator if you're not doing this on your own. Or you may have a friend or a partner. In my neighborhood alone, there are a couple of women that team up and just walk, and they've been doing so for years. Again, that's a commitment you make to each other. You have company and you're moving your body and they're walking. They're just doing some brisk walking. So that counts as movement. So to recap, 4 strategies I want you to focus on that you can do right away is assemble a really reliable practitioner team, understand the necessity of having different people on that team. What I actually didn't mention was that team can also include things like a massage therapist, an acupuncturist, a chiropractor. So in other words, other practitioners that look at other parts of your body, not directly related to cancer, but related to flow of energy, to overall flow of life force, to addressing chronic pain or chronic side effects, recurrent side effects that we still experience from some of our cancer treatments. It can be a spiritual counselor or religious counselor. But the side of us, the emotional, mental, spiritual side of us, is just as important to focus on in post-cancer care as is the physical side of us, making sure that physically we are all right. So again, let's go to the experts. Let's maybe find people in our community, but let's commit ourselves to addressing that part of us too. Energy healers are incredibly important. Many of them work virtually. They're not that expensive, but it's accessing the subconscious, which is also important in overall healing, because we control a lot with our mind, and that really is the tip of the iceberg, and that big lump underneath the water hidden away, that's our subconscious, and it directly controls what our conscious mind thinks and does and feels and reacts to. So while seeing a counselor and doing talk therapy has a place, but if we really want to shift underlying emotional patterns and that we have been needing to release, we really need to do some modality that accesses the subconscious. And there are different types of modalities of energy healing available to you. We kind of have to experiment what really fits, what suits us, what we feel drawn to. But the overall point here in this conversation here is just to clarify, we need to also look at that side. That's not voodoo or something that we can ignore. It's actually a very, very important component of overall healing from cancer. So strategy number 1 was assemble a really reliable practitioner team. Strategy 2 is approach or adopt a nutraceutical and supplemental protocol that is supervised by a clinician, that relies on data that we get. By the way, that was number 3. Number 2 was collect data from lab work, because it's always better to know, to understand what we have and to react to that. If you have, for example, lingering leaky gut or intestinal permeability, that causes havoc in your overall digestion, in your inflammation process. It can lead you down the garden path of even to certain autoimmune diseases. We want to know that. We want to act on that. If we've gone through chemotherapy, we will have some degree of leaky gut, intestinal permeability. We need to address and heal that. So again, collect the data, understand what's happening. Nutraceutical supplement approach, people say, but that costs a lot of money. Well, it's always your choice to do what it takes or to do what is convenient. There are different tiers and approaches when it comes to nutraceutical supplements. How many do we take? But we have to take certain supplements in order to influence our internal environment to make sure it's not conducive to cancer growth. It's part and parcel of our overall healing strategy. And many people will have to just reconsider, what am I spending my money on right now? What do I prioritize? And every single client of mine that gave me that response, and I said, please check on where you're spending your money on, comes back to me and says, I actually am finding ways and means of making this work. My life is important to me. And that's all we can do, doing what it takes, right? And then the 4th strategy was focus on whole foods, clean foods, and get moving. Make sure that you move your body. I have written an extensive blog on this. You can find that on my site, KirstinNussgruberCancerCare.com. It deals with a couple of other key strategies that we can include in our post-cancer care. Just know that there's a lot we can do. That's what I do when I coach my clients. And if you're ready to do that, you can hop onto that same website and schedule a free 50-minute session with me, assessment session, to make sure that, we are a good fit. A coaching relationship works both ways. I've also written a book, Confessions of a Cancer Conqueror, and you can find that on either Amazon or you can find that on my website as well. There's a little video explaining the background of the book there too. So I wish you good luck in your post-cancer care. Know that it's not just a watch and wait strategy. There's a lot you can do. And maybe we'll meet one day. Again, Kirstin'sCancerCare.com. You can follow me on Facebook. You can find me on Instagram, on YouTube as well. And I also have a couple of podcasts which are available on Apple Tunes and Stitcher as well, and Spotify. So take care for now.